We just continue and finish today with the content of the gross anatomy of the bones, where we have started with, we are familiar with the bones, and we are going to study the bones in subsequent courses. But this part of this particular bone, where we have begin with to talk about like classifications of the bone, how to classify like appendicular or axial skeleton, how this particular element is can be categorized. It can be categorized according to the looks: long, flat, irregular, pneumatic, sesamoid. We understand these particular bones, how they are can be classified of. Now, if you are talking about the compositions of the bone, principally this particular bone is made of like the calciums, which is like organic element which is holding this particular bone. So, these compositions of this thing are extracellular substance which is forming of this like collagen and calciums, which is present like 2/3. 1/3 is made of like collagen or other ground substances, and cellularity is only like 5%. That means these principal cells are basically this principal element is basically a living structure, but the cellular content is less. So, we are going to see some cells which is present in the bones. We call them as osteogenic cells, osteoblast, osteoclast, and osteocytes, etc., etc. So, this part will cover in histology. So, in whenever you are going to study the microanatomy, this part will cover the cellular part and how they are arranged. This is how we are going to classify this part, and gross anatomy of the bones we have started with. We are slowly learning about this particular bone, like long short bone we have learned one. We learned one of the flat bone yesterday. So, next day we will be learning a long bone, and by this time we understand this particular long bone, which is of a growing part, have got these few parts that we have learned. The middle part of the shaft we call them as diaphysis. Originating from that particular area we call them as primary ossification. Then we have this particular epiphysis, which is basically developing from secondary ossification center. In between them we have a cartilage plate that actually grows, makes the bone to grow in length or in width. That's is point of interest for us, because if we have a destroyed epiphyseal cartilage, we are not going to get a full length bone or full width bone. So, this is what we have learned with this particular element. Now, this particular diaphysis which is nearing towards this epiphysis or epiphyseal plate, we call them as metaphysis. So, which is a end of this particular bone we can classify all. Now, as this particular bone grows, this particular epiphysis plate gradually grows and fuses with this epiphysis and the diaphysis, and this particular epiphyseal plate merely becomes a line, we call them as epiphyseal line, and then there is a continuation. So, the epiphysis, metaphysis and diaphysis, just like a long bone happens to occur. So, this part we have learned. Now, different types of this particular epiphysis can be classified of. There are different types of epiphysis which are present. We can call them a simple epiphysis, compound epiphysis. That means, if you have single epiphysis and that is growing and fusing with the bone, we can call them a simple epiphysis. They may be having 2 or more epiphyses there. So, that may be joining with themselves and then joining with the bone. That kind of epiphysis we call them as compound kind of epiphysis. There are some other epiphysis which is related to the joints, we call them as pressure epiphysis, on which this particular bone is making frictions and taking kind of pressure. That is why we call them as pressure epiphysis. Just like this humerus head or this particular head of this particular bone, we call them as femur, we call them as pressure epiphysis, which is related to the joints. And this particular epiphysis is lined by some kind of cartilage, which is in blue in cap you are seeing, we call them as epiphyseal cartilages. There are other types of epiphysis, we call them as traction epiphysis, where these big muscle tendons are anchored or attached on that part and putting some kind of projections or tractions and making a change of the epiphyseal shape. We call that particular epiphysis as traction epiphysis. There are some other epiphyses, they are known as atavistic epiphysis. Basically, they are a different bone migrating and roaming from elsewhere, settling down on the bone and making a part of a bone. We talked about this particular coracoid process yesterday, haven't we? This coracoid process is basically another bone where growing at this region of this particular back of our body, and later on this particular epiphysis fuses with this particular flat scapula and fitting with this scapula, making this coracoid bone. So, this kind of bone which is coming from elsewhere fitting in, we call them as atavistic epiphysis. There are another epiphysis, we call them aberrant. That means they are supernumerary or extra kind of epiphysis. We call them as aberrant epiphysis, which is present in the metacarpal bones, like the thumb bones, like that. So there are different types of this particular epiphysis there. And other than this, we have this particular epiphyseal plate, which is of point of interest. This epiphyseal plate grows in length and width, and we get a bone there. If we do not have this particular epiphyseal plate properly placed, we have a trouble in bone growth. That's for this particular epiphysis important. Now, this particular epiphyseal plate can be divided on based on this particular cartilages which are there. Some of the cartilages which are present above, middle and lower part, they are there. Slowly they are going down and becomes ossified. That means this particular epiphyseal plate, the lower end of this becomes, or joining with this particular bone, becomes ossified. This is how this is gradually above down becoming continuous with the bone. So beforehand we see that this particular thing is separate. This particular plates was there. So this particular plate, as it is lower portions, fuses first, then this particular upper part keeps on growing. So the bone length grows. This is how this particular element is growing in here. So these are point of interest. Epiphyseal plate is a exam short note. We must prepare that with the clinical significance of epiphyseal plate. That's what we are going to talk today to understand this particular epiphyseal plate and the growth of this particular epiphyseal plate. And for that, we have to go to the blood supply of this particular long bones. But before that, we just go to the other parts of growing long bone, which we have already talked about, shaft and epiphysis or epiphyseal plate. Now we are talking about this particular element. We call them as periosteum and endosteum. They are really important content of this particular bone. They are a covering of the bone. They are sleeves which is covering this particular bone on the exterior side and interior side. Now what do you mean by the exterior side? Now if you look at this particular bone, this is outer side of the bone, right? So this is a cross section of the bone taken from this particular bone, we call them as femur. So this particular femur, upper end of the femur is, we have taken a cross section, and this cross section is taken from this particular middle part of the bone. This part of the bone we call them as shaft or diaphysis. Okay. Now surrounding over on an outer table, we have a covering to the bone. We call them as outer covering of the bone. We call them as periosteum. Now this particular periosteum, if you just take it out, just focus into this periosteum. It has two layers. One is outer layer of the periosteum, which is facing the muscles and exterior, and there is an inner side of the periosteum, which is basically layered with this bone cortex. Clear what I am trying to say? So this particular periosteum has an outer side which is on this side, which is attaching with the muscles, and this particular periosteum at the same time has got inner layer which is breached with which is attached with this particular layer of this bone cortex or bone itself. So this particular periosteum outer side is made of fibrous element which is giving attachment to the muscles. The inner side of the periosteum is osteogenic. That means it is having live cells inside. So this particular periosteum architecture very important for us to understand the bone growth and bone remodeling, etc., etc. So if you take this particular element of circular structure as a periosteum, it has got two layers. If you put the two colors in it, that makes these things clear. So they are adherent with each other. Now we can take this particular layer purple and layer white. The layer purple is facing the inner side and this white one is facing the outer side. Now this layer purple is fitted with this particular bone developing cells. That means the cells which are present in the bone, they are present in here. So they are resting on this particular layers of this inner periosteum or inner layer of the periosteum. Clear? Now if you have a fracture, for example, and we have a fracture of a bone. Now with this fracture, that particular fracture heals with the reunion. That means once this bone is snapped, once the bone is fractured, it is broken down, right? So then we have to fix this bone to put this particular element in alignment, right? Now for this particular bone to regrow, We are not going to do anything. We are just like putting this particular bone straight and putting a cast. Plaster kore di na, we put a plaster on it, we call them as cast. So we cast it externally, but we are not doing anything. We are just keeping this particular bone in normal position and casting with some supports. Rest thing the bone is doing on its own, or which is known as bone remodeling once it is broken. Getting it what I am trying to say? You are understanding what I am trying to say? So that particular bone remodeling is largely solely dependent on this particular periosteum. Why? This particular bone to remodel should have an intact periosteum. If this periosteum is breached, মনে করো periosteumটা ছিঁড়ে গেছে এর সাথে সাথে, তার মানে if we have a breach of periosteum and if this periosteum is broken, this particular inner cell or inner layer of the periosteum which has that bone remodeling cells will be migrating out and no more bone remodeling cells will be there. So to go in a remodeling phase following a fracture, this periosteum is a must have. If you do not have a periosteum, the bone reunion or rejoining cannot happen. Clear? So there lies the importance of having an intact periosteum. If it is breached, यदि छिड़े जाए, नष्ट हो जाए, खत्म हो जाने से bone reunion कभी नहीं हो पाएगा. Right? So the fracture bone will not be united no matter how you put a cast on it. Even if you just put a fixator, we call them as some nails. कभी कभी बताया होगा plate लगाना पड़ेगा, ये लगाना पड़ेगा. So those kind of things which is known as fixators. So to reinforce more, some of these elements are required. This is one requisite for this bone remodeling following fracture is that you must have an intact periosteum. So here lies the importance of this particular periosteum which is known as outer periosteum. Clear? Now coming to this particular inner layer. Now see that this particular bone is taken from this region and this particular bone is taken from this diaphysis. Now this part of the bone which is taken from epiphyseal region, this part of the bone we call the spongy bone. We will be coming into it. What do you mean by the spongy bone? What do you mean by this particular compact bone? Now this particular area as well, the spongy bone is occupied by this medullary cavity, some kind of fragments of this. We call them as trabeculae, filaments, which is present in here. But again over here, the inner margin of this inner side of this element, which is separating the spongy part with this particular outer table of the bone, is having another membrane. We call them as again endosteum. So this particular endosteum is present inside of this particular bone. Periosteum is having outside of this bone. Periosteum is the essential element for bone reunion or bone grow. If you do not have this thing, we have big trouble for us. Now coming to this particular two things about this particular bone. What do you mean by this particular spongy bone? What do you mean by this particular medullary cavity or this particular cavity bone? Now in a gross structures, if you see that this particular bone have got ends, we call this end we call them as epiphyseal end, which is upside. This part we call them as shaft or diaphysis end. Now if you see this particular diaphysis, this region, we find this particular cross section over here. This is a solid bone which is present in here. We call them as cortical site. Now inside to this particular region we have this cavity, we call them as medulla or medullary cavity. So outer cortex and inner medulla, this is how we can classify the different parts of the bone. Now this particular inner medulla is occupied by some element, we call them as bone marrow. Now this particular bone marrow are of two types. One is known as red bone marrow, other is known as yellow bone marrow. This particular red bone marrow was there when we were young, before 10 or before that age. This particular area was producing blood cells. Later on this particular blood production ability of this marrow will be exhausted. Then it will be replaced by fatty tissues. So this particular region will be occupied by the fats. It will be red one will be replaced by yellow tissues, which is fat tissues as a packing material in here. Now coming over this upper part, so this regions of the bone remains throughout the life is as a bone marrow present. So here we have still the bone marrow present in this particular upper end or lower end of the bones, where we still have this particular bone marrow existing, which is present as a spongy bone region. So this middle portions of the medullary cavity is occupied by the bone marrow, which is still growing, and tentacles or filaments of the bone spicules may be running in here, but no solid things is there. So, this region is still producing this particular blood cells and having this particular red bone marrow and producing the blood cells. Ends of the long bones like femur or this particular tibia which is close to the joints are made of these particular elements about bone marrow. Outer side which is made of this bone which is known as cortex, and inner side we call them as medulla. Medulla is occupied by marrow or this particular spongy bone which is occupied by this particular blood producing cells or bone marrows in here. So, marrow cavity, we understand what do you mean by the marrow cavity. Now, we move to this particular clinical understanding of this particular significance of this particular long bone. Blood supply is the important thing. Now, as I am saying, this particular bone is a living structure. In nutrition, the nutrition is coming through some blood sources. That means, blood is bringing the nutritions. Whatever the molecule it required, protein, sugar, etc., is coming through the blood. It is a living tissue, it needs oxygen to survive. So, the oxygen is again coming through the blood. So, blood supply to this particular bone is essential or must have, so that the bone is surviving there. So, to have this particular bone surviving in this atmosphere, we need blood supply. Now, this particular bone has got a aberrant blood supply, that means a plentiful in supplying the bloods. So, there are number of the blood vessels which are supplying to these particular bones at different levels. This is one example we are putting in here, ideal case of a long bone blood supply. So, there are different regions of the bone which are supplied by different blood vessels which are supplying to it. The prime supply of the blood, say for example 80% of the blood which comes to the bone is coming from the set of artery, we call them as nutrient arteries. So, these arteries which are known as nutrient arteries is bringing the blood source, oxygen, etc., 80% load of it. So, it is pierced by the central part of this particular bone like this nutrient arteries, it pierces through the foramen within bone. So, if you study this particular long bone, you will find this narrow slits there in the middle portions of the shaft. That particular opening we call them as nutrient foramen. Through that particular nutrient foramen, these nutrient blood vessels, artery and veins runs here. So, this particular nutrient artery comes here in the middle portions of the shaft. Once it gets inside this or penetrates this particular cortex, you understand this cortex, right? So, outer bone table it pierces here and then it reaches in the cortex, then it coming over here, it splits. One goes up, one goes down. So, it is one is vertically going up and one is vertically going down. So, we call them as bifurcent branch. That means, it is dividing into two, above and down. Now, as you can see, this particular branch is going down to this part and dropping down to this part, reaching to which part of the bone? Metaphysis ends, right? So, this one is going towards the metaphysis and this one is going down to the metaphysis as well. And then there is a dead zone. After metaphysis, it cannot progress because we have this epiphyseal plate and then which is barred there. So, at the metaphysis, it reaches there, then it finds no space to grow further. What does it do then? It drops back. So, once it reaches to the metaphysis, hits the ceiling and then it is dropping down just like water current. Upore gelo, upar mein jaake hit karke niche aa raha hai. So, it is making a bend. That kind of bend, once it reaches to this epiphyseal plate or metaphysis end of a bone, we call them as hairpin bend. We call them as hairpin bend because it is bending like hairpin, U-shaped bend, right? It is going down and coming up like this. So, this kind of bend which is present, we are talking about this particular blood supply to which kind of bone? A long bone which is still growing. That means, it is not done or finished with the growth part. So, this blood vessel which is coming over here and coming down, which is known as becoming over here and making a bend. Then another set of artery which supplies this particular bone, along with it, this nutrient artery, we call them as metaphyseal arteries. So, they supply principally the metaphysis region only. So, penetrate there and supply. They are tiny blood vessels compared to the nutrient foramens. The third set of artery, they supply this particular epiphysis. That means separated island of the epiphysis separated by this epiphyseal plates. So, three sets of arteries, they are penetrating this particular bone substance. One is in the diaphysis, we call them as nutrient arteries. Then we have this particular metaphyseal arteries which is restricted in the metaphysis region only, but they are tiny vessels which are present compared to the nutrient artery. And the third variety which is supplying this epiphysis only, that means is supplying the isolated epiphysis, which is making the joint that part. Then we have another set of artery which is known as periosteal artery. Why this artery is important? Periosteal arteries, because we have the living cells of the bones which are present underside of the periosteum. Remember that we talked about? So, this side of the periosteum or inner side or layer of this periosteum have got living tissues which are the cells which are important for bone remodeling growth. So, they are present in here. So, this particular region need to be supplied with a special blood supply. So, this supply comes through this artery, we call them as periosteal arteries. They are equally important like this periosteal membrane. If these arteries are not there, if this membrane is breached, we also have the same consequences. Bone remodeling, bone regrowth is not there. There are some parts of the bone which are having less blood supply with the periosteal arteries. We are less supply with this particular periosteal supply, leading to the same fate. Bone remodeling is not happening properly. We will talk about that when we talk about the bones, which part of the bone particularly have poor blood supply or less periosteal arteries. Now, this much we are clear with, right? Nutrient artery and nutrient artery, how does nutrient artery move over there in this region? So, these nutrient arteries are your exam short notes. So, you have to discuss about this particular, the normal course of a nutrient artery. Clear? Now, talking about this particular nutrient arteries over here. Now, what happens after this particular bone growth is over? So, once this bone growth is over, that means epiphyseal plate is fused with this particular diaphysis and metaphysis is continuous with each other. So, you become a continuous bone. So, one is this particular epiphyseal plate fuses, this blood supply of this metaphyseal arteries and this epiphyseal artery also anastomose. That means, what do you mean by anastomosis? That means they join with each other. That means this is epiphyseal arteries, this is nutrient arteries, this is metaphyseal artery. They are separated with each other, they are not touching with each other. Once these things are done with this bone fusion, they are close together. So, this metaphyseal artery, nutrient artery, blood cells and as well as epiphyseal artery, they are joined with each other with the branch exchange. We call them as anastomosis. We call them as anastomosis. That means they are having a link up between them. So, blood can flow through between these arteries. So, from this metaphyseal to the epiphyseal to the nutrients and vice versa. Clear or not? Okay. So, this thing, once we have these things achieve bone growth. So, for example, for you guys still some bones are growing. For me it is degrading, I am losing the bone. So, it is already fusions is there and for a long time it is there and is working. So, I have every bones with this arterial networks are anastomosed. For you guys still there, something is happening, but it is on the verge of mature phase. Now, the clinical problems lies with this architecture of this particular thing in case of the young individual. So, we are still talking about the young bone growth, that means the individual is young, kid of like 7 years old still have this particular bone yet to grow and it is going, and this particular nutrient artery is going up and bending and have got hairpin bend. Now, as it has a going up to the ceiling and bending down, there is a sluggish blood flow through this particular hairpin bend. That means the blood flow through the bend is slow. Once you has this bend over any roads, the traffic slows down, is it? The same thing happens in case of the blood flow to the arteries and the vessels. So, we have a slow blood flow through that bends. ওখানে তো আমাদের ব্রেক চিপতে হয়, আস্তে করতে হয়. So, same thing happens with the blood flow as well. When this particular blood flow through the metaphyseal end, it slows down. Now, if we have a slowness of the blood flow to any parts of the body, there are chances of settling down of the infections more. Am I clear? So, if you have a slow traffic on this region of a particular blood regions or of a particular anatomic region, if you have any infection, that infection gets more time to settle there and can create an attachment at this particular point and can create spread of infection that part. So, that is why in case of these young children, this metaphyseal end of a growing long bone is more prone to have infections. So, comparing with this diaphysis, comparing with this particular epiphysis, comparing with this metaphysis, the metaphysis of a young children is more prone to have infections. Explain why. Can you explain it with your anatomical knowledge? Yes or no? Yes. Now, how we are going to state that? So, if I ask the question, in case of 7-year-old, a metaphyseal infection or bone infection is more common than that of a 27-year-old man. Is it right or wrong? You said explain why. If you say right, then explain it. If you say wrong, then explain it. So, how we are going to explain that? Okay. So, simple thing, you have to explain the normal anatomy. What happens in the architecture of the blood vessels which are present in the metaphysis? It has a bend there. So, traffic slows down. So, if you have an infection, somehow it is coming to it, that particular area of the bone, the infection can be getting more time to settle down there and spread over there and remain there, because the blood supply on the bend is more or less more. How? Why? Why less? So, but blood flows more fluently in the bend. No, it slows down. Oh, it slows down in the bend, right? So, once it bends, the blood flow slows down. So, that's what you have to explain. No, we just like talk about the kid yet. Then we'll come to you. Age বেশি হয়ে গেলে কি হচ্ছে তারপরে বলবো. So, first we understand why the bone is still growing, then we can talk about something else. Am I clear or not? We are clear or not? So, how are you going to explain? Explain why a 7-year-old suffer with the metaphyseal bone infection. Due to a bend. And why there is a bend? Dead end of there because of the epiphyseal plates which is not united with the epiphysis yet. So, there is a anatomical trouble or anatomical trouble point or anatomical weakness is there in case of the young children. Now, what he was saying, whenever growth is over, grown person, well, what you are saying? ও আচ্ছা বেশ, তাহলে আমরা বড় হয়ে গেলে ওটা কি সোজা হয়ে যাবে? Right, good question. So, what happens once we are grown over there? Sit down, please. So, once we are grown, what happens? The hairpin bend will be phased off, will not be there. থাকবে না তো, সোজা হয়ে যাবে তো, কি হবে তাহলে? তাহলে বড় বয়সে হলেও তো হতে পারে, তো হচ্ছে না কেন? ম্যাচিউর হয়ে যাচ্ছে তখন? সেটাই বলছি, সোজা হয়ে যাবে তো, সোজা হবে না, তাহলে কি হচ্ছে? হ্যাঁ, এপিফাইসিয়াল প্লেটটার সাথে এটা জুড়ে যাবে, এটা তো আনইউনাইটেড আছে, এটা এপিফাইসিয়াল প্লেট জুড়ে যাবে, এপিফাইসিয়াল এন্ড এটা মেটাফাইসিসের সাথে একদম পুরো জুড়ে গিয়ে পুরো এপিফাইসিস মেটাফাইসিস ডায়াফাইসিস এক হয়ে যাবে। এখন তো সেপারেটেড আছে, তো তখন এই বেন্ডটা কি হবে? চলে যাবে না হবে? থাকবে। উইল দ্য বেন্ড রিমেইন দেয়ার অর নট? Bend will still remain, but blood supply gets improved. How? Anastomosis. So, we have more supply from the other sources. Epiphyseal artery, metaphyseal artery, they are united then, anastomosis. So, blood, even if it is slowing down, somewhere it is pouring more blood. Hey, chal, they will be pushing, throwing these things. They will be getting more blood there. So, the blood slowness is no more there. So, it's not about this particular bend. हम लोगों का bend से कोई दुश्मनी नहीं है, मुश्किल है कि वो स्पीड कम हो जा रहा है. So, स्पीड कम हो जाने से तो बंदा बैठ जाता है उधर में. So, thing is getting worse once you have the bend, the slowness of the blood flow is there. Once this slowness is recovered by some additional help like anastomosis from the other vessels, So they are united over there. What are the other vessels uniting? Metaphyseal artery, epiphyseal artery, nutrient artery, together they are coming and pouring blood. So that particular sluggishness over the metaphyseal end is no more there. And this is for typical long bone. So long bone infection, we call them as osteomyelitis. So this is what we have to keep in mind regard to this particular element of the blood supply. So this is what we are talking about over here. So we have different sources, metaphyseal artery, epiphyseal artery, and this particular element which have got hairpin vein, young adults, they are united there, becomes this particular thing continuous, and anastomosis between this particular thing which you can see in the lower end is explaining. So we have this particular thing, low blood flow zone is no more there. So we can have this particular thing recovered. So is there. This is about long bone. There are short long bones are there. The story of the short long bone is little different. So what happens for the short long bone? That's for you guys to find out. Is the same architecture remains there, or there is a different thing of this particular short long bone? Find it out and bring it to me. So this is about blood supply, we understand that, right? And then we talk about this particular cells, we detail of these things, blood cells in this particular bone, we will talk in histo classes. But anyways, so we have osteogenic cells, where from this particular osteogenic cells are like great grandfather cells, from which divides into smaller site, osteocyte, osteoclast, like this. They form the bone or break the bone, they remodel the bone, whole thing, and they give this particular architecture of this particular bone in this particular compact bone and as well as this particular spongy part of bone. If you take a cross sections of these things, this central part is medulla or medullary bone. This part we call them as cancellous part of the bone, where you can see some pores inside. This one we call this as this particular system, we call this unit of this particular bone, compact bone, as osteon. Osteon is a small unit over here, and this particular osteon is layered by lamina. That means it is a circular pattern which is existing in these osteons. Now if you cut through this particular osteon, you will get inside to it some kind of tunnels presented. That tunnels we call them as haversianal canals, we call them as Volkmann canal. So this osteon, if you cut it, you get kind of a porous canals like underground or submerged canals there, through which the blood vessels and the cells crawl through and settle the bone architecture. So this particular inner network of this haversianal canal and the Volkmann canal runs through this osteon, through these particular bones. They are modeling or remodeling the bone entire thing, right? Now where from these particular things have a rest house, this particular osteogenic cells or this particular osteoblast, osteoclast, this settle down on this particular regions under this particular covering of this bone, we call them as periosteum or inner layer of periosteum. From there they migrate and do the job and come back again, settle down or feed there. To feed this particular osteogenic cells in this region, we have a dedicated blood supply. They are known as periosteal arteries. So these things are working like this. So detail of this particular bone architecture of these regions we will talk about in histology sections like Haversian system, canal system, etc., etc. We will talk about in histo. This is microstructure. We cannot see that in a gross structures. So this is how it is going on, transverse sections and horizontal section. This is transverse section, it looks like this. If you make a horizontal section, it looks like this. So they are kind of comparative pictures that we are seeing here. So this is about this particular bones that what we are going to talk about. Brief about cartilages that we have to know. There are three different types of cartilage are in our body there. One type of cartilage we call them as fibrocartilage. One kind of cartilage we call them as hyaline cartilage. A third variety we call them as elastic cartilage. These are the three different varieties. The elastic cartilage have got different collagen fiber elastage. That's why it is elastic, like ear pinna or nose anterior septum or eustachian tube in our bodies. They have this elastic cartilage tissue. There are some tissue which are fibrous in nature. They are required for the high pressure point. Between the vertebra, we need some kind of cushion element. We call them as intervertebral disc. Like one vertebra, another vertebra, we need a cushion here. So that when the vertebra is moving, we do not get these things jarred. So that kind of cartilage which is thick, we call them as fibrocartilage. The fibrous element is more and they are kind of very good shock absorber. A third variety we call them as hyaline cartilage. Hyaline word means glass. They are transparent, right? They are coating on the area where we have the most of the frictions, just like joints. If you have this particular hyaline cartilage which is present in these regions of the joint, so this is known as hyaline cartilage, which is capping or covering this joint surface of the bone. Now this particular joint surface of the cartilage slowly wear and tear worns out, gets partially or completely destroyed, slowly like this. They eat out like this, and eventually this particular hyaline cartilage cap is gone. Then the bone make contact with another bone, and one bone fights with another bone like anything, and that's why this particular bone cries, it pains. We call this particular pain as a knee pain or joint pain like that, and that is the reason why we call them as osteoporotic damage or osteomalacia, etc., those kind of bone disorders that is happening, and that leads to the bone replacement. So that's why we call them as knee replacement surgery, hip joint replacement surgery. We are not replacing the knee or hip, we are replacing this particular cartilage cap in it. So this cap is destroyed, we are replacing the cartilage cap, capping it again, and that too cartilage cap that you are replacing has a life. This one was surviving for like 50 years. The cap you are giving may be surviving for 10 years likewise, right? So this is how this particular classifications of these cartilages are there. We call them as three of them: fibrocartilage, hyaline cartilage, which is look like glass, and we call them as elastic cartilage. They are present in the pinna, voice box, etc., etc. They are there, and the other detail of these microstructures we'll talk about in the histology classes. All right. So this is about the bone. Study about this particular blood supply or vascular supply of this particular bone, and which part of the growing bone is more prone to have infection and why. Explain why. If it is a growing case of these long bones, which part, and if it is short long bone, which part is more vulnerable to have injuries, I mean infections, and why. So that's for your homework to do. And other thing about epiphyseal plate and the epiphyseal plate blood supply and the epiphyseal plate growth that we have to learn and understand. Okay.